purified fat from pure graft. It's got some PRP and stem cells in here to help activate the fat and get it to survive. We're gonna make this athletic male have a little bit more in his medial calves. And so we're gonna go right into that area that I've already marked and bulk it up. Do nice strands of the fat because we want the fat to survive. You don't wanna over bulk it. It's really important when you do this that you're doing this three-dimensionally. So we're doing a different shape. We're doing contouring. We're doing it not just straight, we're curving. We're following the leg in 360, well, not 360, but around the area. So it's contoured. I think there's something, probably do that more. And you can see already after a few syringes, look here, the bulk of his calf. So some of the fat will leak out because we're putting in the subcutaneous area. So we want to blend with the last one, then I'll show you one side versus the other. This is a really good treatment for guys that don't want to do an implant. And you can use the fat when we do our high-def lipo because we're using in other areas. Now this patient doesn't have a lot of fat, so we're trying to utilize the fat the best possible, which is why we're focusing it here in one area. Because he doesn't have a ton for me to be using it into other areas. What are they saying? All right, I guess this sucks. Anything?
We have a quiet crowd right now.
What? Quiet crowd.
We have a quiet crowd.
It's a weird
we have
day.
someone says so fascinating.
No, it's true.
Someone is fascinated with this.
So if you take a look now, this medial calf has much more
Looks
than
great.
The other side. You can see. I'm going to do just a little bit more over here by the tibia, because that's where he doesn't really like that he has low volume.
Now, is he going to feel any pain from this afterwards?
Not much. I mean, most of the time, there's minimal, if anything, here.
It's a pretty easy recovery from this.
We're using a cannula, so the fat's put in pretty reasonably. And then just gotta build a little bit at the bottom section here.
So it says, wish it was my surgery watching live. We can do your surgery live if you come schedule one.
Yeah, why not? It'd be amazing.
Is he under general anesthesia right now?
Yes, he is.
He's asleep.
Yeah, that's good. There you go. Okay, so that's good for the medial there. I'm gonna try and we want to keep that fat inside. We don't want it to leave. Much better. So now I'm gonna do the other side so you guys can see. You can see here, much better contour. We're trying to keep the fat in there. You don't want to push it out. Now we're going to go to the other side and do similar. We've already pre-marked. We're going to superficially. Every time, everyone is different as to how much.
What does his post-surgery look like?
You guys know, if you're following me, it's the same thing every time. Our high-def lipo requires 7 to 10 days of downtime. 7 to 10 days of downtime. We do aftercare.
We do
he's got in garments. IV, hyperbaric therapy. Inquire with us, you guys. We'll give you more information.
And yes, for those asking, he is a lipo patient. Let's show you.
Yes, we had some sculpting and revision done, and he's tight.
All around, check it out. If you guys are interested in the aftercare, we do feature some of that on our lives, so please stay with us and we'll keep you updated.
You can go to IGTV or you can go to my YouTube's under massage and IV, hyperbaric. It's all there. So again, we're following the areas superficially. And we're trying to make it very blended. Okay. Small. I'll use one more of this and I'll switch. You can see some scar tissue from the previous surgery. We try and remove the majority of it the best that we can during the grafting and filtration process. And sometimes you're gonna get some in there.
How long does this whole procedure take?
Well, this surgery today was about 5 hours, 6 hours. Depends on what you have done. You'd have to see it. It's all customized, you guys, every time. And everyone asks the same questions, how much time and how much money. But I can't tell you without seeing you.
And if you do want to book a consultation, we can do that for you. We can do virtual consultations. They're about 20 minutes. And we can do in-office as well. You can book one on our website. You can click on book a virtual consultation. It's towards the top.
There's one on mrcosmetics.com and also at Jason MRMD. So you can literally get the consult at either place. Perfect. So again, we're trying to keep that fat in the area that we want, shaped, and the lumpy bumpy will go down. It's gonna blend. You guys can see already, look at the size difference. Okay. Couple more areas to shape. A little bit more here, a little more here, a little more here. So we may make it more even. More of the area that we really shaped out. What we were describing initially. Perfect, good. Oh, hold on, we want to keep that in. Don't want to let it out. Hold on, we're gonna move it. Remember, it's in the subcutaneous tissue, so if we want it to survive, we have to keep it there.
Are you
Perfect.
under the muscle right now?
Nope.
Subcut-
We're in the subcutaneous tissue, like I just said. In the subcutaneous tissue, okay? We only go into the muscle in certain areas.
Will you visit Boston like you do New York?
We do New York, Chicago, and soon Miami. But this type of procedure you really should have here. This is a once-in-a-lifetime procedure. Okay, now we're gonna do a little bit more at the base to build the bottom. And blend this everything. Perfect, good. Okay. That was the even number, right? Okay, so now I'm just gonna massage lightly the direction I want it to go. I'm gonna try and keep the majority of the fat in there. I'm gonna show you guys each side, take a look. Much bigger. Even in both?
Correct.
Okay, I think that's good. That's what he was looking for, was more bulk. Let's do one more on this side. Same thing with the smaller one. This side needs a little bit more. You guys can see right through here.
What's this treatment?
This is fat grafting the calves.
This is own fat. We did purify it with pure graft. This was done through HC lipo.
And you blend.
Calf implants with filler question mark?
Yep, this is fat.
This is his own fat. This is not an implant.
Let's take a look at both. Looks good. Perfect. So the one side just needed a little more. We're going to close that up because we don't want that to come out. And that's it. So why don't you pan to show them the results. Put his legs there. And now we have bigger medial calves. I'm going to do a little on the back there. Do the same thing. That's it. Great. You guys can end there.